Today, I will talk on a model of a cancer survivorship care for breast cancer patients in Korea. In Korea, the elderly population is expanding rapidly and patients' numbers are increasing rapidly. But fortunately, we give out cancer screening for breast cancers by using mammographies, uptake rate about 70% recently, and the cancer detection in early stage rate is rapidly increasing in Korea. So 5-year survival rate of breast cancer is over 90s in Korea. So it's a fortune, good news, but we concerning about the cancer patients' care, called cancer survivorships after treatment. Cancer patients and survivors numbers is rapidly expanding, and the cancer patients live longer after cancer treatment. But we developed cancer treatment skills in hospitals, but we do not have a good model for patient cares in community and after treatment. I want to focus on the top model. Recently, we tried to care the breast cancer survivors in communities. Care means caring for their symptoms, physically and psychologically, but include the rehabilitation of their social functions and job return. Our model is divided majorly two. One program is operated in hospitals. We open the cancer survivorship clinics by physicians, and we opened already multidisciplinary doctors rounds clinics. The multidisciplinary doctors clinics met of one patients about 5 doctors. One doctors are breast cancer surgeon, and one doctors I'm a family doctors. Me, one doctors are rehabilitation doctors. One doctors are psychiatric doctors, and one doctors are pain management specialist or gynecology doctors. So we met together complicated problems of cancer survivors after treatment, and we discuss many things and give counsels about how the patient can deal their caring after treatment. Includes symptom cares and psychological support by drugs or counselings, or how they can exercise and physical activities doing, and how they can eat healthy. About that, we counsels, and if is there any difficult problems the patients suffered. Example, patients have edemas and patients and limitation of movement of arms, or the patients have severe depressions, and physical function is lowering, then we refer a specialist to further evaluation and treatment. This is one model in a hospital. And we in hospital, we advanced the hospital model is we opened a comprehensive cancer survivorship care programs. The program operate by the other multidisciplinary teams, not only of doctors, but also we involve the nurses, psychologists, and the rehabilitation experts, and social workers. When the patients are referred or come to the comprehensive cancer survivorship care programs, we ask to fill out the questionnaires to assess their problems. And we divide the risks they suffered based on the questionnaires. When we found the patients have big problems and high risks to suffering ongoing and give a big effect to their life of qualities. If they have big needs of medical care, then the coordinator, the programs report to the doctor's clinics. And they suffered from many economic burdens and family problems and social problems. Then they report to the social counseling teams. And we communicate together, medical teams and the social support teams, and to support and help the patients to live well, better. The other model we set newly in community. We opened the Reborn Center. The name can means rebirth after treatment and beyond cancer. The Reborn Center operates to support the rehabilitation of social functions and support job returns and startups for cancer survivors. Recently, 3 cancer survivors companies are working in the Reborn Centers, and Reborn Center operates a regular education program to job rehabilitations and startups supporting. And Reborn Center also function as a network and communication centers for all the other economic sectors and cancer survivors. So we regularly make conference and seminars, and we invite cancer patients and educate to roles as a cancer patient's mate. Mate means friends, not counselors. They are not experts, but they experience of overcoming cancer. Cancer patients can be good friends, mate for the other cancer patients. The cancer patients' mates can go with cancer patients to shopping, to a park for resting, and with education programs and modules that like one day about the 1-2 hour activities models, and we educate and give roles cancer patients mates, and they can earn some monies by these activities. We educate the cancer survivors some skills, make some goods. Then we open the market to sell the goods. It's a kind of economic supporting. And we also prepare the small box gardenings in cancer hospitals and invite some cancer patients and divide the gardening boxes, and the cancer patients can rear the flowers and vegetables in their boxes. After we provide the boxes or gardening boxes, cancer patients mostly very hate to come cancer hospital to treatment or diagnosis, but they said, I'm happy to come to hospital to see my flowers and vegetables growing. It's another happiness and improve the life of qualities. And recently we open field gardenings to rear healthy vegetables. We share the small parts of lands to agricultures, combinations of rehabilitations of physically, psychologically after cancer treatment. It's our combinations model gardening and agriculture to cancer patients rehabilitations and cures. We starting and ongoing develop new models to support cancer survivors' life quality and cure and rehabilitations in communities. And we try to communicate with the comprehensive care programs in hospital and the community activities. It's an ongoing program in Korea. The number of cancer survivors are increasing and cancer survival rate is increasing. But this means cancer burden in societies and cancer survivors' needs are increasing into the society. We need to prepare to support cancer patients come out from the patients to the healthy social members to support the caring comprehensive their health problems to reduce their symptoms physically, psychologically, and increase the physical functions, and need to support rehabilitate their social functions and support the economic functions can make a return to healthy social members. We can do it. I think so.